The gastrointestinal system. Examination of the abdomen. Here is an extract for a textbook description of how. Sorry, again. Examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. Note, if the abdomen is distended by fluid or gas, the presence of fluid can be confirmed by demonstrating shifting dullness, percuss, or tap. First with the patient lying supine, flat on their back. Then ask the patient to lie on the side and percuss again. If fluid is present, the dull note heard on the percussion moves. Palpate each region, feeling for tenderness, pain when touched or masses, palpable enlargement of tissue. Note also any guarding or rigidity. Showed by contraction of the abdominal muscles, guarding may be due to tenderness or anxiety and can be reduced if the patient is pursued to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is totally removed. It is a sign of periodontitis. Listen for vowel sounds. The facies. There are several words for the facies. Doctors sometimes say there was blood in the stools. Have you passed black stools? Patients sometimes say my motions have been very loose lately. Bowel movement is used to refer to defecation. Have your bowel moved today? Have you have bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in the bowel habit could constipation, heart, infrequent stool of or diarrhea, frequent soft or solid stools. Normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale: hard, form, semi-form, soft or loose, liquid or watery. The color can vary from black due to altered blood, as in melanema, to yellow, gray, or even white. Melanina stools are often described as tarry, like tar, the black sticky substance that is used in road making. The stools may be red when fresh blood is present. Blood that can only be detected with special tests is called fecal occult blood, FOB, where there is high fat content. The stools are pale and are sometimes described as clay colored. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Complete the case report. Case 14. Physical examination revealed a thin girl with sleep pallor. She was not obviously dehydrated. The temperature was 35 Celsius, pulse 100 per minute, blood pressure 110 with 80 milligrams. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not. There was generalized, which was most marked in the right lower, and was associated with, but not. There was no rebound, and no were felt. Sounds were reduced. Match the descriptions of the stool with the condition most likely to cause them AF using your medical knowledge. Type of stools: loose bloody, loose pale, bulky, clay colored, black tarry, small heart, clear, watery with mucus. Condition: gastric ulcer, irritable bowel syndrome, ulcerative colitis, cholera, coliatic disease, obstructive urine. Match the features to the doctor questions. Blood, bowel habit, change in bowel habit, bulk, color, consistency, offensiveness. How often do you open your bowels? B. Are you going to toilet more often than normal? C. Are the motion hard or loose? D. Do the motion have an unusual smell? E. What about the appearance of the stool? Have you passed black stools? G. Is the size or the amount of the stools normal? Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. The abdomen can be divided into that four quadrants.